I want to invite Wee Hong Nguyen to the podium. He is responsible for the regulatory and external affairs at Abbott Nutrition in Vietnam, and is going to be speaking to us about industry action to improve regulatory systems. So welcome.
Good morning, everyone. Thank you very much for the invitation. So I would like to present the industry action to improve regulatory system as a Vietnam experience. Next slide, please. So as all of us know, regulations are crucial for society. But we also know that the quality is most important. So too many regulations may not be good. We know that President Donald Trump have stated in the executive order 30 January 2017, whenever an executive department or agency publicly propose for a new regulation, it shall identify at least 2 existing regulations to be reviewed. So it means that in some cases, there are so many regulations which impact to the public health also. Definitely, no regulation is not good, but too much and too complex regulation is also not good for the public. Similarly, in Vietnam, there are so many regulations on that impact to the growth of the country. So from 2016, the Prime Minister Nguyen called for administrative procedure reform, that he called drastically cut administrative procedure, remove sub-license, in particular better control of placing additional procedure. So to optimize the regulatory system, it needs contribution from the whole society, especially from the industry, to share the best international practice and harmonization with international standards. Next slide, please. So in Vietnam, the US company in AmCham and US ASEAN Business Council actively support Vietnam government to improve the regulatory system. In 23 November 2015, the US ASEAN Business Council signed a memorandum of understanding on partnership to strengthen healthcare in Vietnam with Vietnam Ministry of Health. There are 9 projects we have done with Vietnam Ministry of Health in this MOU. 2 projects already completed, 7 projects are ongoing, and 3 new projects suggested in 2019. There are 7 in 9 projects are focused on strengthening healthcare system, and 2 projects are focused on improving health status in a specific area. Next slide, please. Then we do high-level government engagement to shape the MOU partnership. We have several meetings with Prime Minister, Deputy Prime Minister, with the Ministry of Health leader, and also we operate with the media to all our activity have been showing in the media like the national television. Next slide, please. For food regulatory system, we are doing in 3 fields. The first is technical support for post-market surveillance. We have project of improving food safety testing capacity that Abbott done with National Institute of Food Control. That project recently completed in 2018, with many testing methods for food products have been standardized. and we did a lot of expert exchange to teach them how to test the product correctly. And currently, we extend the project to 2019 and 2020 for other testing method and technical exchange. Then for scientific and technical, we have 3 projects on nutrition that Abbott conducted with Mother and Children Protection Department and Medical Service Administration of Ministry of Health to win 3 national guidelines and implemented them nationwide. The first is the national guideline of prevent and manage gestational diabetes mellitus. Second is the national guideline on maternal nutrition. As you know, that maternal nutrition impact a lot on the healthy of the infant. So that we in Vietnam we are the rate of stunting and malnutrition baby is still high, with 25% of children stunting and 14% of the children under 5 years is malnutrition. So we decided that maternal nutrition is very important to improve the health of the children. Then also we having the national guideline of clinical nutrition for the patient in hospital, because the rate of the malnutrition in hospital is very high, which most of the doctor did not pay attention in the nutrition. So we provide the method of nutrition screening for the hospital and how to choose good nutrition so that it having improves treatment and reduce the hospital days. For improving food regulation, in 2017, the industry, including AmCham, requested the Prime Minister to improve the food safety regulation, and we work intensively with the government and Ministry of Health to win the new decree on implementing food safety law. And that new decree had been issued in February 2018. We focus on risk-based management. We split food into high and low risk group for different levels of control. In the past, every food product having the same requirement. So it's taking a lot of time of the authority to review and give the approval. And they do not have the time for the market for make the post-market surveillance. So by splitting into the high-risk group and the low-risk group, now the authority has more time to focus on the post-market surveillance. So that we simplify the paper requirement in granting certificate to reduce administrative burden. Why we clearly define the responsibility of local health authority to go to the market to take the product for testing and to monitor the food safety. And we make the regulatory requirement clearer for easier implementation. And next slide, please. So to get this result, we are working very extensively with the government, not only the health authority, but also with the top government. So we having the dialogue with the government consulting committee of reforming administrative. And as the Vietnam we raise issue through the Vietnam Chamber of Commerce. And then they raise the need of improving food safety regulation in the government cabinet meeting. And we made this very well known by the public by several symposia that we sponsor by and organized by Vietnam Chamber of Commerce. We invited a lot of participants from both authority and the industry and consumer association. They also were widely discussed in media, And we also directly meet with the Prime Minister during Vietnam Business Summit to discuss about the food safety regulation, and finally the new regulation have come which improve a lot. Next slide, please. For strengthen the regulatory system, that we also work in three things: that building regulatory agency, that ZSK leadership program for ASEAN senior healthcare policy maker to build capacity on healthcare policy in terms of financing, health technology assessment, health outcome. That project have completed in 2018. Then we have Lily public-private partnership project to empower the community to better diabetes management. And we also work in improve drug regulation, that the industry contributed to win decree number 155, which issued in 12 November 2018, which significantly changed the drug import requirement towards simplification and harmonization. Next slide, please. So our efforts have been recognized by the Vietnam government. In 26 December 2018, Vietnam Ministry of Health recognized the administrative procedure reform is one of 9 outstanding events of healthcare sector in 2018, with following conclusion. For the drug, that decree 155 cut down 72% of the business investment condition and 72% of administrative procedure. For food, decree 15 cut down 98% of government inspection for 5 groups of imported food. And for the financial benefit, that Ministry of Health states that the total estimate after cutting down the business investment condition, administrative procedure, and the need of specialized inspected goods under the Ministry of Health Management have saved more than 8.5 million working days and about $130 million US. Then with the industry effort, the Ministry of Health have gave the award for the company who provide big support to strengthen healthcare system. So as in the picture, is the Ministry of Health giving the award for Abbott for our contribution, and the Minister of Health, Nguyễn Kim Tiến stated that 2018 was a very special one for the healthcare sector, with many breakthrough achievements made, thus contributing to increase access to healthcare for rural people, increasing the quality of examination and treatment, developing the public-private partnership model, and further facilitating business activity. Next slide, please. Then the lesson we got is the healthcare industry play an important role in improving the healthcare sanitary system because they have scientific expertise and they have the international best practice that they can share. And how to get it? That is, we set the common goal with the government to improve the public health, and we focus to address their main concern. One key of success is we work as a team, not only the international company. We work together with the local industry and to give the appropriate comment with the right strategy and investment. We well communicate with all involving authority and party, not limited in health authority, to get the best alignment and support. And now we have the open and transparent communication to media and public. It is very crucial that to get the public alignment to achieve our common goal to improve the public health. That is my presentation. Thank you very much for your attention.
And thank you very much, Mr. Nguyen.